So let's look at an overview of the biosafety and biorisk management standards. So we're going to look at just 4 standards that you may use to implement a biorisk management program. So we're going to look at the ISO 15190, the ISO 35001, the CWA 15793, and the CWA 16393. So there are a lot of other standards that apply or are available out there. But then for the sake of this particular mentorship, we're going to concentrate on these particular standards. So what is the outline? Of course, we're just going to look at an overview of the 4 standards. So let's look at the ISO 15190. So what's the focus for this particular ISO? So the safety in medical laboratory environments is the focus for this particular ISO. So it mostly looks at the medical laboratory environments. So it will not give you any type of requirements if you are not from a medical laboratory background or a medical laboratory institution. So it will only give you requirements for safety in a medical laboratory environment. So it was published obviously by ISO, which is the International Standard for Organization, or the International Organization for Standardization, ISO. And then it complements the ISO 15189. So if you need to implement a safety program or a safety management program using the ISO 15190, you need to also implement the ISO 15189, because the ISO 15190 is not a management system ISO. So it will not, if you implement this ISO alone, you can never put up or implement a management system, and therefore you need to implement it in conjunction with the 15189. Then also the aim of this particular ISO is to ensure occupational safety in the medical laboratories. So what are some of the key requirements that it will give you? So vaguely it will give you safety management system, but like we have, like I have talked about, you can't really implement a safety system or a safety management system using this ISO alone. You may need the ISO 15189. Then it will also give you some responsibilities that you may need for safety. Then hazard control, so to give you requirements for hazard control, so to give you requirements for biological hazards, to give you requirements for chemical hazards, as well as your physical hazards, radiation, as well as your fire hazards. So it's not, it will not only give you requirements for your biological hazard, it will cater to other types of hazards as well, such as your chemicals, as well as your physical hazards. Then it also gives you some requirements in terms of your PPE usage. It will give you requirements for training and emergency preparedness. Then it will also give you some requirements for incident reporting, as well as how do you design your facility that will ensure that you have a safety working culture, as well as you are working in that particular lab, your facility design is making sure that people are actually safe in the facility. So what are the benefits of using this particular ISO? So one, you're going to have reduced exposure and accidents, because you're going to have a proper incident management as well as emergency preparedness program. Then you're going to have improved compliance and improved lab culture in your laboratories, because you would have at least complied to some of the requirements that are either international or national. Then also you're going to have good laboratory work culture, and therefore you're going to have a safer working environment as a facility or as a laboratory. Then you're going to have better staff morale and trust, because at least people will know what they are doing. They will know what to do at each particular point. and that will boost their confidence as well as their morale, and therefore you have trust either from the members of staff, then you're also going to have trust from the top management or any other partners that you may be involved with. So let's look at another ISO standard. So we have the ISO 35001. So this is a biorisk management ISO. So the main focus is for you to implement a comprehensive biorisk management. So to give you requirements for you to have a comprehensive biorisk management program. So now, key emphasis on biorisk. So this particular standard only concentrates on the biological hazards or the biological agents. So it will not give you requirements for chemical, it will not give you requirements for physical, fire, or any type of hazard that you may find in the laboratory. So this is the major difference that you have between the 35001 and the 15190. So like we saw in the 15190, it will cater for all the hazards that you may find in the lab. But then for this particular ISO, it will only look at the biological hazards. Then the good part with this particular ISO is that it not only gives you requirements if you are from a medical laboratory, it gives you requirements for all labs that are handling biological materials. So it applies to all labs handling biological materials. So you may be a medical laboratory, a medical laboratory that is handling biological agents, or you may be a non-medical laboratory that is handling biological materials. So it will cater for all the types of laboratories that are handling biological materials. Then it's built on the Annex SL structure. So this is the structure that is used for all ISO management, all ISOs that management system type of approach standards or ISOs. So unlike the 15190, so 15190 is not built on this structure, but then this ISO is built on this structure because if you implement this type, or if you implement this ISO, you will have a management system in place. But then for 15190, like we said, you cannot have a management system in place if you implement it alone. You need to implement it in conjunction with the 15189. But for the 35001, you can actually implement it on its own and you will have a management system implemented. So what are the key requirements in this particular ISO? So it will give you requirements for leadership and organizational contexts. It will give you requirements on your risk assessment and incident response. So for risk assessment, it's both the biosafety and partly your biosecurity, but mostly it will give you your biosafety risk assessment. Then support training and documentation. So it also gives you requirements for performance evaluation and continual improvement. So what are the benefits? So this ISO aligns with other Annex SL structured type of ISOs. For example, it will align with the ISO 9001, which is the quality management system ISO. Then it also aligns with the ISO 14001, which is the environmental management system ISO. Then also the 45001, which is the occupational health management ISO. So it aligns with these ISOs because the way it is being structured is similar to these other ISOs, and therefore it communicates with these other ISOs. Then it encourages proactive safety culture. then also prevents misuse and accidental release. So it caters for the biosecurity risks. So another difference between this ISO and the 15190 is that 15190 mostly doesn't look at your biosecurity risks, or it doesn't really cover the biosecurity. It mostly looks at the safety. So it's a safety ISO for medical laboratories. But then for this ISO, it is a biorisk management ISO, and therefore to cater for both the biosafety as well as your biosecurity risks per se. So let's try to look at this ISO. Let's try to look at another type of standard. So we're going to look at the CWA 15793. So CWA stands for the Sane Workshop Agreement. So it was, or these type of ISOs are created through Sane Workshop Agreement type of meetings or coming together of certain types of organizations, countries, so that they come up with a common solution to a common problem. So this is how most of these CWA ISOs were created. For example, the 15793 or 15793. So this is a comprehensive framework for a biosafety and a biosecurity program. So it's both for biosafety and biosecurity. Then also, like the 35001, it not only caters for medical labs, it also caters for all labs that are handling biological type of agents. Then it's based on a management systems approach, and therefore it will follow a certain structure similar to the Annex SL structure that the ISO management system standards follow. So it is designed for all laboratories that handle biological materials. I think I've already covered this part. Then it served as a foundation for the development of the ISO 35001. So it was from this ISO, or from this standard, that the 35001 was created from. So the only difference between this particular standard and the 35001 is that this one is a free standard. So it's a voluntary type of standard and it's free. So if you want to use this standard, you can use it in any way or in any time that you want to use it, or any country can use it, and it will not really bind you to it as compared to the ISO standards. And then the other difference is that the 35001 is not a free document. So the 35001, you need to buy it, and there are all these copyright issues that come with the 35001. So if you implement what is in the 15793, you implement almost the same thing that is in the 35001. So if you are an institution that maybe you don't have maybe the funds to buy the 35001, you don't have the capacity to do that, but then you still want to implement a management system that will strengthen your biological agent, or they will strengthen how you are handling your biological agents. The CWA 15793 is a good alternative for that particular process or that particular implementation that you may want to do. Then the CWA 15793, it is derived from the current WHO biosafety and biosecurity guidance. So if you implement what's in this particular standard, you'll be meeting certain requirements or certain compliance requirements that are in the WHO biosafety manual, as well as your biosecurity guidance. Then it is consistent with other international standards such as the ISO 9001, the 14001, and the ISO 45001. So this is a similarity between the 15793 and the 35001. They are both are consistent or they align to these other management system type of ISOs or standards. Then it's not country specific, so any country can use it without getting into any type of legal battles and the like. Then if you have any local solutions in terms of standardizations and everything, you are free to use them. Yeah, there won't be any issues that will arise from you using your local solutions. Then compliance with national and local regulation is mandatory. Of course, if you're implementing this standard, you need to also comply to some national as well as some local regulations that will work together with this particular type of standard. So let's look at it a little bit more in detail. So let's look at the sections that the CWA 15793 has. So the CWA 15793 has a total of 4 main sections. So most of the meat is in section 4. So mostly in section 1, you are going to have the scope. So in section 1, it will tell you the scope of the document itself. Then in section 2, it will give you the informative references. So the references where most of the information came from to create these particular standards. Then in section 3, this is where you'll find the terms and definitions that are used in the document. But then if you go to the section 4 is your biorisk management system requirements. So in section 4, this is where you'll find the requirements that this particular standard would want you to actually conform to. So now under section 4, you're going to have 6 subsections. So you're going to have section 4.1, which will look at the general requirements for you to actually have a management system. Then under 4.2, this is where it will give you the requirements for you to come up with a policy, either at national level, at facility level, or international, depending on what you'd want. Then under 4.3, this is where the planning requirements are. So this is where you'll find your risk assessment and anything that is related to you planning for your biorisk management system. And then under 4.4, this is where you're going to have your implementation and operation. So under implementation and operation, this is where most of the information is consistent. So this is where to give you the different types of implementation strategies or implementation measures that you can put up if you find that your risks are unacceptable. So there's quite a lot of information under 4.4, especially in relation to implementation and operation. Then under 4.5, you're going to have checking and corrective action. So how do you do your corrective action, and how do you just check whether or not your implementation strategies are actually reducing or eliminating the risk itself. Then under 4.6, this is where your review is. So how do you review your overall management system? How do you do your management review and the like? So how do you do a proper review of your system? This is where you find most of the information. But then the way the standard is structured, it will give you some information under assessment. So under assessment, mostly you find that under the planning. So that's where your assessment will be. Then your mitigations or your implementation. So this is where now you'll find the information in 4.4. And then your performance also information will be found under 4.5 and 4.6. So that's how this particular standard is structured. It's structured in the AMP type of model, and this is where the AMP model was gotten from that we mostly use during our biorisk management system trainings or implementation strategies. Okay, so let's look at CWA and how it is performance oriented. So mostly it would just describe what needs to be achieved as you try to implement your risk reduction strategies and the like. And then also it allows organizations to determine how best to achieve those objectives. So it will not it will not tell you to stick to what it tells you. You can also come up with other variations on how you can achieve your objectives. Then it's not a technical document. It's not really a technical document. For example, under 4.4.4.5.3, under waste management, it states that the organization shall establish and maintain an appropriate waste management policy for biological agents and toxins. Therefore, it will to tell you some form of management and not really technical type of information. So let's look at this other type of CWA. So this is one of the CWAs that is mostly used in implementation but is not mostly known. So we have the CWA 16393. So what is the CWA 16393? So the CWA 16393 is a companion document to the CWA 15793. So what this document is simply a vocabulary type of document or an implementation CWA. So the CWA 15793 will give you certain requirements that you may need to put up as a laboratory for you to achieve your biorisk management implementation systems or processes. But then it will not really spell out the steps that you need to take for you to implement. And therefore, this is where now the 16393 comes in. So then the 16393 will then give you how to implement it. It will not just tell you what you need, it will tell you how to implement it. So it's a vocabulary so it simply explains what 15793 is talking about. So if 15793 says you need to do a management review as a laboratory, it will end there as 15793. But then 16393 will then tell you what key areas you need to review. So it will tell you how each of these particular areas under your management review, how do you get the information, and how do you maybe make sure that each of the key areas that you are reviewing is meeting the requirements that 15793 was talking about. So that's mostly what 16393 is. It's an implementation type of CWA. So if you want to implement the 15793, and then you are, or maybe if you are implementing 15793 and then you are having challenges on how to implement it, you can always go to the 16393 and it will be able to guide you on how to implement. So content, so it has similar sections with CWA 15793, but gives information on how to implement the CWA 15793. So I've already touched this part. So what's the goal? So the goal is to promote consistency in understanding and implementing biorisk controls and systems, specifically the controls and systems that are communicated in 15793. So it's supportive. So it's really not a standard in itself, but it supports the CWA 15793. And later supports the ISO 35001. Like we earlier discussed, 35001 was derived from 15793, and therefore if this particular document is supporting 15793, it means that it's also supporting 35001. Key competency areas. So what are the key competency areas that it will spell out? So like we said, it's not really a standard on its own, but then it will communicate, or the same key competency areas as compared to 15793. So, but some of them are biosafety, biosecurity knowledge, and legal awareness, risk assessment and incident management skills, communication, training and ethics, as well as ongoing professional development. So basically that's one of the key competencies that it will talk about. Then CW163 as implementation of CW15793. So here we're just trying to explain a little bit more in detail why 16393 is an implementation of 15793. So it supports implementation of CW15793 through trained personnel. So it will give you information on how to actually conduct the trainings and therefore to support the implementation or the standards or requirements that were in CW15793. Then provides competency framework aligned with Biorisk principles. Then ensures qualified professionals lead safety programs. Then it strengthens organizational biosafety culture and compliance. So it is mostly there to strengthen the implementation of 15793. So let's look at a summary where we are going to compare some or all the standards that we've talked about in relation to some features that are found in each of these standards. So we have the CWA 15793 in column 2, 16393 in column 3, 35001 in column 4, as well as 15190 in the last column, while what we're comparing them to is in the first column. So let's look at the type. So what type of standard is 15793? So 15793 and 16393 are both CWA standards. That is the same workshop agreement type of standards. But then the only difference between 15793 and 16393 is that 16393 really isn't a standard per se. It's mostly an interpretation of vocabulary standard to 15793. Then both 35001 and 15190 are ISO standards, but 35001 is a management system standard, whilst ISO 15190 mostly is a safety requirement type of standard and not even a management system standard. So what's the main focus? So for the CWA 15793 and 16393, for 15793 is mostly biorisk management for all laboratories, and then for 16393 vocabulary, so it's just mostly interpreting what 15793 is talking about. Then for 35001, biorisk management for all biological handling organizations. So I should have added only, so it only looks at biological agents or organizations that handle biological agents. But then for 15190 gives general safety in medical laboratories. So general safety, so it doesn't touch security. So scope, so CWA 16393 and 15793, all labs that are handling biological agents. Then also 35001, all labs that are handling biohazardous or biological agents. But then for 15190, this scope is for medical laboratories, not specific to biohazards. So it also looks at other hazards, like we already discussed. It looks at the chemicals, it looks at the physical radiation, as well as your fire hazards. Structure, so for 15793, the structure is PDCA based. So it's the plan, do, check, act type of structure that it follows. So assessment, mitigation, performance can also be rephrased as plan, do, check, act. So it's basically the same thing. Then 16393 is in a glossary type of structure, or definitions type of structure, or implementation type of structure. So it's same structure like the 15793, but in an interpretational or definition type of structure. Then 35001, the structure is based on the ISO Annex SL structure. So this can be looked up. So it's a 10 clause type of system that most management system ISOs use. But then for 15190, it's mostly prescriptive safety requirements and not a management system. So it will tell you what you need for you to be safe, but then it will not tell you what you need for you to have a system that is making you to be safe. So it's telling you you need to have a lab coat, you need to have a sink, you need to have proper flows, you need to have proper lighting, you need to do risk assessment, but then it's not telling you to do it in a systematic way that will give you a continuous type of safe working culture. Unlike the 35001, which will tell you what you need, but then it will tell you in a systematic way, in a way that whatever it will tell you now will be linked to what it will tell you in the future. So if it's telling you you need to set up documents, it will later on tell you the importance of having the document in a systematic way. Risk management. So CWA 15793, risk management is the central component. Then 16393, not applicable because it's the same thing as 15793. ISO 35001, risk management is also the central component. But then for 15190, there's limited information on risk assessment. So there's limited to physical and operational safety measures. So mostly risk assessment is not the main aim or the main central component that everything will revolve around. For these other types of ISOs, 35001 and 15793, everything is centered or is revolving around your risks. That is your risk management. So that's the central component for everything that you're doing in the lab. So certifiable. So you cannot get certified using the CWA 15793 or the 16393, but then you can get certified using the ISO 35001. Then you can also not get certified using the 15190 because it's not a management system standard, therefore it's not certifiable. But then if you need to get certified in biorisk management, you can use the 35001. Is biosecurity included? So in CW 15793, there is biosecurity. Not applicable to 16393 because it's the same thing as 15793. Then biosecurity is included in 35001. So there's both biosafety and biosecurity in 35001. But then in 15190, there is no biosecurity. If it's there, it's really, really limited. It's just maybe mentioned, not really being a central or one of the main components. So mostly it focuses on biosafety and not biosecurity. So mostly it focuses on the safety risks and not the security risks. And therefore it's not a biorisk type of standard. Emergency preparedness for both the CWAs is implied or it's included, but then for the ISOs it's included, but then for the 15190 there's limited or the emergency preparedness is limited to lab safety and not any type of organization handling biological agents. Biosafety level guidance for CWA is implied, and then for 35001 the levels are also implied. 15190, but then it's implied but based on the WHO lab standards. So whenever the guidance from the WHO manual changes, then the biosafety level in 15190 also changes. So for example, right now we're not using biosafety levels in if we look at the WHO for the Laboratory Biosafety Manual for the edition, which is from the WHO, and therefore that also changed in the 15190. So we're mostly using the facility characteristics such as the containment, the biocontainment facility features such as the core requirements should be heightened control measures as well as the maximum containment. So whenever something changes in the WHO in relation to the safety levels, the 15190 also changes. Terminology support. So terminology support for 15793 or 15793 is mostly through or via the CW 16393. And then for 16393, the main purpose is terminology support and not really as a standard. Then 35001, it has built-in definitions, plus the support for terminology is also in the 16393 like we discussed. Then 15190 has limited terminology support. What is the audience? So for 15793, the main audience are lab managers, biosafety professionals, and for CW 16393, practitioners using CW 15793. So we're talking about the lab managers, biosafety professionals. So anyone that the 15793 has prescribed to be the main audience is the same audience as 16393. Then for the 35001, the main audience are the Biorisk officers, biosafety, biosecurity officers, as well as auditors. Then 15190, lab safety managers, healthcare lab personnel. So the difference here is that 35001, there's biorisk officers, which means biosafety and biosecurity officers. While for 15190, it's just the biosafety, not biosecurity. So that's the main difference between the audience, between the 35001 and 15190. Okay, so how do you implement the standards? How do you make sure that you are correctly implementing whatever you're implementing? So mostly the first thing you need to do is you need to conduct a gap analysis, so gap assessment. So this is where you're looking at what does the standard that we want to implement, or what are the requirement in that particular standard. Then you compare what the standard is saying or is telling you to do with what you currently have. Then after you do the comparison, you find the gaps. So what are you not doing that the standard is saying you're supposed to do? Then after that, you then implement what the gaps were, or what gaps you have found from what you are doing in relation to the standard itself. Then another thing is you need to train staff and update SOPs. So training is one of the most important, as we discussed earlier on. It's one of the key elements here. If you need to set up a management system, then update SOPs. So documentation and document control is one of the key elements as well. Then integrate with the existing system. So whatever you found are the gaps in the standard that you're looking at, you need to integrate the gaps with what you're currently already doing. That way you're going to have a robust type of management system. Then if the standard that you are currently implementing or you're trying to meet the requirements of is a certifiable standard. In this case, from the 4 standards that we've talked about, the only standard that is certifiable is 35001. So if you are implementing or you want to meet the requirements in 35001, you can then later on pursue certification, because that particular standard is certifiable. Then, of course, almost all the standards you need to comply, since you are putting them as your overall mostly standards. So therefore, you need to make sure that you are compliant with all the standards that you are currently trying to implement. But in terms of certification, only 35001 is certifiable in biorisk management. So how do you implement standards? So like we've discussed, you find that maybe there's a lot of information that will be in the standards. As we saw from the CWA 15793, there are a lot of sections there that have subsections, which have subsections, and therefore you would want to ask yourself, how is it possible to implement what is in these standards? For example, the 163 or 15793. So the best way to implement a standard is by how you would eat a dinosaur. So how would you eat a dinosaur? So as we know, a dinosaur is believed to be a very big animal. We've never really seen dinosaurs, but then from what we've seen, the fossils and everything, whenever they recreate them, they are like really big animals. So how do you eat a dinosaur? So the best way to eat a dinosaur is by eating it slowly by slowly. So you eat it one bite at a time. So you start maybe with the head, or you start with the tail, or you start with the legs and the like. So you eat the dinosaur one bite at a time. You can't eat it in one day. You maybe eat it in a couple of months, and if it's a very big dinosaur, maybe even years for you to just finish it. So, but then by the end of the eating process, you need to at least eat the entire dinosaur. So one bite at a time. So that's the same way we implement standards. One bite at a time, one section at a time. So you get one section, implement it, monitor, then you move to another section if you're satisfied with what you've implemented in the previous section. That way, by the time you're finishing the 6 or 10 sections that maybe a standard will have, you would have completely implemented the entire standard, like the way you would have eaten the entire dinosaur. So these are just some of the references. So mostly the information came from the Laboratory Biosafety Manual, 4th edition. You have the Biorisk Management Laboratory Biosecurity Guidance. Mostly it came from the latest edition, which is the 2024 edition and not the 2006 edition. Then the CWA information came from the CWA 15793. Then we also got information from the 35001. Some information was also gotten from the 15189. Other information was gotten from the CWA 16393 as well, so that we do the comparisons and or the information that you may need, or the requirements that each of the standards follows. So if there are any questions, kindly leave any questions or comments or any contributions or clarifications or contradictions. You can always leave them in the comment section. But that's all I had for you in session 1. So we'll see you in session 2.